Okay. So everyone, thank you for joining us. I know you've seen a few of the emails and flyers that have gone out. We're very excited that Barbara Otto will be speaking here today to you and to the audiences online. I just want to give brief introductions, some background on Barbara's really extensive background here, just to kind of give you some context and why we had brought her on board and thought that you guys, this would be a real value added training here for membership. Barbara has a proven record of bringing together unlikely partners to tackle complex social and healthcare problems. Ms. Otto is a policy analyst with extensive expertise in Medicare, Medicaid, and Social Security, as well as other public benefit programs for older adults, children, and adults with disabilities. For 26 years, she was at the helm of the nonprofit Smart Policy Works, which was formerly Health and Disability Advocates, a driving force behind building smarter systems of health and social determinants of health for vulnerable people in places across the nation. In 2021, she launched Smart Policy Works LLC to expand her reach with public and health sectors to build stronger and smarter public systems to serve medically and socially complex populations. Barbara started her career at Ernst & Young. She served as a consultant to both Cornell University and Virginia Commonwealth University on disability employment. She was a principal for the National Consortium for Health Systems Development, a state-to-state technical assistance center that work with Medicaid programs in 39 states. In Illinois, she founded several health collaboratives cut across the health, social, and government sectors, and has played a key role in the expansion of Medicaid in Illinois for medically and socially complex populations. She's been a technical author on important reports to Congress, including Medicaid and Chip Payment and Access Commission, and President Barack Obama appointed her to the advisory group on prevention, health promotion, and integrative public health council. That's amazing. So thank you so much, Barbara, for being here today, and I'm going to hand it over to you. Oh, I think you're on mute.
Thank you. I have to, it's so awkward when someone reads your bio. I'm sorry you had to read so much of it. Thank you, Jody.
No, I think it's great. I think it's great to know all of that. So
thank you. It also makes me feel so old. So in any event, I'm really glad this is an intimate group. I was sharing with folks, and I'll put up my screen so you can kind of see what the title of the presentation is today. But I'm just really excited about the opportunity to speak before you again. I did speak a while back, after the passage of the Affordable Care Act, when you as an association were really trying to think through how you were going to navigate that big change. And I'm really glad to be back before you again, because I really see a great opportunity to connect some dots at the community level. More and more Americans and more of your residents are being treated for mental health issues right now, but the mental health outcomes aren't getting better. They're just not getting better. Post-pandemic, the country's mental illness crisis is more pronounced, and it's really highlighted some of the really serious infrastructure challenges we have with mental health care. The fact is the mental health problem in America is medical, but the solutions aren't just medical. And that's what's so exciting about the role that you and your association play, because the real problems behind mental health in this country are social, environmental, and I think some people would say also very much political. And so you guys already know all of that. I think you saw some local communities decide yesterday that they feel that there needs to be more of an investment and they'd like to have more control over their investments. I think you guys won, or mental health boards won 7 new mental health boards. Is that right, Jody? And I think that's a real recognition that communities are looking for more community-based solutions, but also really looking for more local and custom solutions, and your association is really uniquely positioned to do this. But you guys already know that, so I guess you're working at the local level every day, so I guess I'm telling you nothing you don't already know. So let me move forward. So today my objectives really are to share with you some of what I've seen in the last 2 years in terms of a real shift in how we make decisions about health and behavioral health care. I'm going to talk about some of this and share some insights on the potential opportunities for you and your communities to leverage some of these federal investments. And we're going to talk a little bit about the priorities that have been happening here over the last year in Illinois, what the Division of Mental Health and the Substance Use Prevention and Recovery has been looking at. And then we're going to talk about areas for aligning some of your strategic investments at the community level. So look, the federal funding trends really have surprised me. The Bipartisan Safer Communities Act that was passed this spring, or actually this summer, was really, yes, it was about gun violence prevention, but really what it was about is the federal government sort of recommitting to our communities around mental health. This is one of the single largest investments outside of the Affordable Care Act that we've seen since 1963 in funding mental health at the community level. I don't need to read off the slides to you. You see all of this, but this is a significant amount of money, $13 billion earmarked for mental health in this bill. And a significant amount of money dedicated towards substance use prevention and recovery services, $940 million that are coming through the Health Resource Services Administration, which is the administration that manages and supports most of our primary care for the poor through federally qualified healthcare centers. There's an $8.6 billion investment coming down the pike over the next 10 years via Medicaid for these community-centered behavioral health centers. And then a significant amount of money going to our schools to help expand mental health services. I think this slide really demonstrates the federal government's recognition that it really needed to not only recommit to mental health, but in my opinion, also really connect spending between what we're doing at the local level and how can we boost programs to support children and youth. And we just haven't seen this type of emphasis prior to this act. I mean, seeing $80 million for pediatric mental health care access programs, this HRSA spending is really focused on how can we train primary care to better identify mental health and to better create pipelines for mental health access. Again, I already spoke about the $8.6 billion for certified community behavioral health centers, but there's also another $50 million coming out of CMS to strengthen oversight for EPSDT in school-based health centers. $1 billion out of the Department of Education for safe and healthy students. And then, of course, the block grants and other services that are going to be there for mental health services in schools. And then the mental health professional pipeline, a real recognition on the part of the federal government that there simply isn't enough, there simply aren't enough mental health workers and not enough workforce to serve the growing need. So how is this translating down to what's happening in Illinois? I don't know if you saw it, but last week, Governor Pritzker announced the Illinois Pediatric Mental Health Care Access expansion of 2.5 million. It's training and technical assistance for pediatricians, and it's designed also to improve telehealth opportunities for youth and children. And then you see a significant expansion just in the last month in the dollars for the certified community behavioral health centers. You know, Illinois received an original grant from SAMHSA under the previous administration, under the Ronner administration, that included some planning dollars and funded about 5 behavioral or certified community behavioral health centers. Unfortunately, the previous administration determined they weren't going to pursue expanding CCBHCs. And it wasn't until the new administration came in that we were able to continue those first 5. As you know, Healthcare and Family Services was really focused under the Ronner administration in integrated health homes. And I think their hope was that the CCBHCs wouldn't be necessary. But I think we've seen that play out, that they're really, the state of Illinois has really realized that we needed to continue what is happening in the CCBHC space. Look, even the initial evaluation outcomes of the CCBHC program found that Centerstone had a 50% decrease in homelessness, for example, of the individuals they served, and a 60% decrease in emergency department use. This really did catch the attention of the Pritzker administration, and so they extended the CCBHCs in 2002 well into 2023, and luckily we now have increased funding from the federal government, and we've seen an expansion to 14 certified community behavioral health centers happening in Illinois. The state funding trends, I've already talked about. We originally had 5. We've done some significant expansion with the federal infusion. We're also expanding behavioral health services for children and families. GMH is explicitly including youth and adults with developmental disabilities. I'm assuming you guys are all tracking that, but the mental health block grant specifically talks about youth and adults with DD. We are seeing an expansion of substance use disorders, services and housing, the Medication Assisted Recovery Now program. I'm sure you're seeing a lot of that happening at your local level. We're seeing an infusion of cash into Oxford houses. And I don't know how familiar you are with Oxford houses, but they're an option for individuals leaving corrections or the carceral system. Unfortunately, they're dry, so they're not necessarily a harm reduction approach that our state has taken on these. But they're also looking, in addition to Oxford houses, they are looking to improve the recovery housing model, and they're looking at the National Recovery Alliance and some of the recommendations they have for tiered structures and a more harm reduction approach. And finally, I know you probably are all experts at this point on 988 and the coordination with the Community Emergency Services Support Act. I know many of you have been heavily involved in this in your community. So as I was looking at this incredible infusion that I feel that the federal government and the state is also taking up into behavioral health, I started thinking about looking at the intersections with your strategy and your strategic objectives. Behavioral health for children, youth, and adults has, I know, traditionally been something that the mental health boards have thought about, especially looking at the impact for youth with DD. I remember in the early days of working with you, that was something that you often looked at. I think there's a real intersection with your work just by the fact that the state of Illinois now has a chief behavioral health officer. He's charged with coming up with a statewide comprehensive strategy in all 102 counties. So he's thinking beyond what happens just with state dollars. And so I think that is a huge gain, not only for the state of Illinois, but for the role that you and your members play. There continues to be this emphasis on the integration with primary care. The state may have moved a little bit away from the total integrated health home model, but with the certified community behavioral health center expansion, and then the Division of Mental Health promoting integration of primary and behavioral health care, they have this acronym that's always hard, the PIPBHC. And then, of course, the state is leveraging all of these increased mental health block grant dollars for training and retraining workforce to not only respond to the conditions we have now in a post-pandemic environment, for example, more telehealth availability of behavioral health services, but also looking at workforce to support some of the newer initiatives like the medication assisted recovery now and some of these crisis units that we established and built under our behavioral health transformation waiver. And then the state is also really looking at returning residents and juvenile justice. So individuals who are involved in the criminal legal system that are returning back to communities. The Division of Mental Health and Super have really been building programs specifically targeted to returning residents and youth, and really looking at that as a significant opportunity to right-size spending and to look at how we are delivering services to this population in the community as opposed to the emergency department. So very specifically, where there are intersections, the investment in 988 and CESA, there's a lot of training dollars for first responders that is coming through the federal government and through the state. And I know that there's a significant amount of coordination. As I said, I know many of you have been much more involved in this part of it than I have, but there's also these final three pieces that I think maybe mental health boards and 377 boards haven't thought as much about. And that is the other strategic investments that the state of Illinois is making at the community level. Healthcare and Family Services has been investing in healthcare transformation collaboratives. These are significant Medicaid investments and social determinants of health and that intersection with primary care and behavioral health. The state just announced another round of projects that have been funded. One of the projects or the transformation collaboratives that has been funded is hyper-focused on returning residents. They funded the Supportive Reentry Network Collaborative. It's currently happening in Chicago and Cook, and that is a collaborative of behavioral health and healthcare providers working together with reentry groups to address the cross-system support needs of individuals returning either from IDOC or being released from custody. I know that other healthcare transformation collaboratives have been looking at that as well. The state Medicaid agency, the Healthcare and Family Services Agency, is also looking at behavioral health transformation waiver expansions. The state of Illinois has a waiver period that mega waiver that we put forward in 2018 is due to expire in 2023. The state is seeking an extension. They're looking to extend beyond 2023, and very specifically, they have not had the chance to implement two key components that were a part of that behavioral health transformation waiver, which is supportive housing and supportive employment. So they've been seeking an extension to work on that. I know that HFS has been reaching out to many key players across the state. I hope they're reaching out to you. It might be an excellent place for an intersection of interests of where you could leverage and enhance their existing investment. And then, of course, the Home Illinois Plan, which is coming out of the Department of Human Services. And in addition to this year, we're seeing a chief behavioral health officer. We also saw Pritzker create a homeless czar. And so we now have this new plan to end homelessness, and looking at very specifically, the state has been seeking how can we identify housing services and housing supports once someone accesses housing for those with significant behavioral health needs. So frankly, when I look at your agenda is really the state agenda, right? The state has really very nicely aligned with what you've already had in place. Now, I know that you probably talked to Dave Albert, and you probably talked to Laura Garcia, and probably David Jones, our Chief Behavioral Health Officer. But knowing you over the years, I know that these have always, especially workforce and preserving and strengthening the 708 and 377 boards, have always been a focus of this group. So I think now that we're seeing unprecedented investment in these areas, I finally feel that you as an association can move beyond maybe putting your finger in the dam and investing in crisis, and potentially can start investing in services like those that I mentioned earlier. Like when we talk about mental health, we know that only 10% of the mental health outcome is always medical. It's the social and physical environments and the cross sort of systems support in the social sector that really help support and really lead to that successful health outcome. So maybe for the first time in a long time, you as a mental health board and a 377 board might be able to begin looking at how do we start shoring up some of that local infrastructure that is so critical to getting the successful health outcomes we want for our residents, and where can we align our funding to either strengthen what the state has already been making investments in, or to strengthen infrastructure gaps in our communities. So very, very specifically, in addition to aligning your board investments with what the state priority areas are, I mean, I think there's a lot of thinking around how could you expand training and services to meet the needs in your community. It's great that the state is putting out dollars to train first responders, but are they thinking about more than just crisis de-escalation, all very important, more than just some of the mental health crises? Are they thinking about the differences about training for individuals who may be elderly or have developmental disabilities that are experiencing a mental health crisis? My experience has been that kind of training for first responders is really not as robust as it is with a more sort of generic training around de-escalation and engaging with people in a mental health crisis. Is your county or community already working with some of these priority populations, like returning residents and youth? Where are ways that you could support those organizations that are working with the population, especially in the areas of substance use disorder? Does your community have a healthcare transformation collaborative? I'd be happy to share with Jody and everyone on this call a link to the healthcare transformation collaboratives. There might be some infrastructure development already taking place with HFS's investment in a local collaborative. Where could you align your investment to either support what isn't being supported to make, or to enhance and make the package of services more robust? Could your supportive housing investments advance what the state wants to be supporting in your community, or fill some of the gaps that the state isn't able to support? You know, I do really believe the state's movement towards leveraging Medicaid to pay for pre-tenancy and tenancy supports is a big one. But as you know, Medicaid is often the payer of last resort. So there are often strict eligibility buckets for some of these enhanced services like supportive housing that leave out large swaths of the population that can't maybe meet that strict diagnosis of severe mental illness. So where could potentially some of your funding provide a similar service, but not for that Medicaid eligible population, more for working poor or for Medicaid eligible populations that don't have the right diagnosis to get access to pre-tenancy and tenancy supports? And then, of course, is the state adequately supporting some of the training of the workforce? I really have found, as I look across the state, that we're seeing increasing numbers of especially older adults with substance use disorder. And I'm not seeing a lot of response from many of our local community agencies, not because they don't know about it, but more because they're not sure what to do about it. It's not a population many of our behavioral health providers, unless they specialize, is used to going out and doing outreach and engagement with. What kind of supports could your association provide local communities who are working with maybe geriatric practices, or are trying to work with local senior centers, or the area agencies on aging that are trying to address some of these needs? So you have some really significant opportunities to partner, and I've already talked about those opportunities, so I don't want to read off the slide here. But the one piece that I did not mention on this slide could be the schools. I really do believe that many of our school-based clinics, we all know they're under-resourced and underfunded, but even more so, they are underfunded in the area for young adults and youth with developmental disabilities. So how can we make sure that those school health services are accessible to that population? So when it comes to potential opportunities and aligning investments, we've talked already about supplementing dollars for staffing and training. But when it comes to the Department of Mental Health, how can you be working and aligning your dollars with the things that Dave Elbert says he wants to invest in with the mental health block grant? How can you help inform, support, and expand the push that he's trying to do with certified recovery support specialists? This was a new category under the behavioral health transformation waiver that the state really wants to sustain. How could that be expanded in your community? How could you inform, support, and align some of your investments with people experiencing homelessness that have mental health issues, but that the state simply doesn't have the resources to support with housing supports? You know, many rural populations live doubled up. That's the standard. How can we make sure that we're either supporting access to housing, or frankly, access to resources to support those families that are living doubled up? How can we support them to keep their loved one with a behavioral health issue at home and provide additional resources to help them care for that person at home? And finally, how are we getting elderly populations or older adult populations who are seeing increasing numbers of homelessness in addition to increasing numbers of substance use disorder. And then finally, how can your investments potentially inform how the state supports telehealth opportunities? Especially in rural areas, we're seeing a huge need for telehealth for older adults, but older adults not having access to either broadband or the technology needed to even access these important supports. And then, of course, the Department of Public Health. Are there opportunities for the investments that DPH has been making in training pediatric mental health care providers, and collaborative care models? Is there an opportunity to support some of that activity? A convening, for example, of pediatricians so they could all come together in one place and talk about what's happening with access to behavioral health services. You all do community health needs assessments. You know what's going on in your community. Is the pediatric response adequate? Could you be supporting that? And then, of course, supporting the alignment of school-based behavioral health services. So there are a lot of opportunities, and I really do believe the certified community behavioral health centers are a real opportunity for us and in our communities. It's there for people regardless of their ability to pay or place of residence or their age. And it's supposed to also provide developmentally appropriate care for children and youth. This is a real opportunity for you and your members to inform what the needs for services are in communities. Sometimes service providers believe they know what those needs are, but you actually do needs assessments, and you can support their ideas with some of the data analysis and some of the environmental analysis that you've been doing at the community level. The CCBHCs are also looking at a high level of care coordination and partnership with social service agencies and local agencies. You know who those agencies are. Your organization has a real opportunity to inform these CCBHCs about what type of social services are critical and how you might be able to support some infrastructure to facilitate those kinds of connections between providers. Again, aligning your investments with these healthcare transformation collaboratives. The opportunity really is are the social determinants of health targeted by the funded healthcare transformation collaboratives in your community aligned with what you already know the need is? One of the things I found very interesting in this next round is a lot of hospitals were funded in the healthcare transformation collaboratives. Well, hospitals, as you know, have a different perspective on community than a mental health board or a 377 board. So how could you help inform and maybe get a seat at the table to talk about how the hospital can be doing things smarter and better? And then, of course, there are a lot of opportunities for you when you look at what DMH and SUPA are investing in. How is what the state wants to invest in aligned with the infrastructure you've always been supporting in your state? How can you help inform some cross-system coordination and peer supports? We always talk about how important that is, but because of Medicaid as a primary payer of many of these services and supports, there are real restrictions on who can deliver services and who can receive those services. How could your association and your dollars help round out that? Right now, many working poor and middle income families are struggling. They're not poor enough or unfortunately sick enough to access many of the supports that are going to be coming through the state of Illinois, through the Safer Communities Act, and even through ARPA. How could you and your dollars help support some of those working poor and middle class families that aren't going to be able to access simply because they make too much money? Or how could you be supporting existing under-resourced programs for people with intellectual and developmental disabilities, older adults, and again, people coming home from the Department of Corrections or jail? So I wanted to leave enough time for us to have discussion. I wanted to just provide you sort of an overview of what I see happening and answer any questions you have, and maybe talk a little bit more about what makes sense for you and your association as you move forward. So why don't I stop screen sharing and let's have a little bit of a discussion.
Great. That was wonderful. Thank you, Barbara.
Since I don't see a lot of hands raised, I guess I would like to know what that I've talked about so far really resonates with you. Is what I've talked about kind of what you've been thinking moving forward? I mean, it's incredible that we were able to get 7 more mental health boards, just, you know, hopefully 8. Are you seeing that your position is strengthening and that you're able to inform the state on some of their objectives?
I think, I know I don't have direct conversations, but I know that Ron Malka meets with Dave Alberts, and I know that he's working in terms of aligning or these types of discussions probably with him. I don't have any specific feedback, Jody. I'm trying to think from.
Yeah, he meets monthly with the trade associations that's convened by David Alberts. So I know Ron asks for anything, any agenda items or anything of any issues or concerns that our mental health boards have. He's always he's on it. He brings it to their attention. I know when our mental health boards weren't necessarily part of the initial application process for the regional task force for CESA, that he and other leaders had made sure to voice that concern. And so now we will have a seat at the table within each of the regions. So I think that's incredible that, you know, we have that sort of, you know, in with them, and they do listen to us, and they do know the importance of our boards and the purpose that we serve in each of these communities.
I'll speak just a little bit because I had gone up to Will County, and I don't think it's on their ballot till March, if I'm not mistaken.
But they just passed.
Oh, they did. Okay, I'm sorry. I looked at the ones, and I would do some background before I went up there, and I looked at what their health department was passing it, and I looked at everything that their health department passed, and it was like 10 times more services than our health department funds. And then I think the question that I saw in newspaper articles was, you know, here you have all this money that you could, you know, put it out for mental health, and they do have some mental health services, but they were trying to get more in there. And I think that's some of the issues is convincing community that no matter how much money, mental health money you have there, it's not enough. I mean, just like that. I mean, very bluntly, I'll say that, but you know, thankfully it did pass in hopefully 7 of the 8. We've have a great relationship with all of our providers, and you know, just different things that we've been able, and I know there's more and more that we need to do. We funded the jail until the county decided to hire their own mental health agency instead of the local provider, which ends the end of this month. We've got counselors in the schools that we fund through the mental health. But again, the schools have found that they need more, so they're adding their own staff. So it's, you know, it's helping where we can. And so, I mean, great discussion. And I think we all try to cooperate with, you know, everything. It's just, we know that there's more to do. And it's just, I mean, housing is a very much needed, I'm sure, in every community. It's just, and then I see mental health agencies that are not mental health boards that are getting out of owning property. So how do we, it's not like the agencies themselves are in a position to purchase new properties. So it's kind of how we can figure that out.
One other thing I might add too is I think a lot of our members have really strong relationships with their legislators. We have, which is really great, and we have a GSA, which is our lobbyist, are good about keeping them informed and our members informed. But I think the relationships that our members have with their own respective legislators is important too. So they know that they serve a critical role in those communities as well.
Yeah, and it's interesting. So I've been in this role for a year, and essentially the way that we've approached it is to, you know, I have a lot of advocacy in my background, so it's just kind of second nature to me. But a lot of what my board does is really look at where the federal and state chips fall and then say, okay, we want to fund in between. We want to fund the gaps, right? So that's essentially the role of the 708 board. So that's not groundbreaking in any way. I think the piece that jumped out to me, you know, we are very concerned about crisis response and 988 implementation. We're very concerned about workforce and investing in that area. It made me realize that we haven't been paying a lot of attention to the CCBHCs and what our role can be in helping to form or mold them. You know, especially we have a few in our area. And so I think, I don't know, it's not really a question, but from your presentation, that was the thing that struck me as, oh, that's kind of in our blind spot right now. We're just watching it roll out and not really being a part of it rolling out. So I think we're going to need to figure out what our role is in that a little bit more.
And I think, you know, I feel like for 8 years that I've been with the DeKalb County Board, it has been just, you know, plugging holes. And we're trying to think so much more strategically. I mean, that's really our focus moving forward. Like, how do we align this much better? And so, Barbara, I really appreciate what you did, because it gives us some thought process behind that. You know, we're also looking at how do we measure our impact in the community in a meaningful way, instead of just saying, well, here's what we fund, but here's how we actually are moving things forward, and having some strategy behind that will be really helpful. And so it just really is, it's a different way to think about funding, to just really get beyond. I feel like we're always behind the 8 ball, and this gives us an opportunity to get in front of it and really look at where are those areas that are most impactful. Because as we watch those numbers come, right here, this funding is coming, and so we can't supplant or supplement those funds. So where do we continue to look at where our dollars are meaningful? And by you making that really explicit helps to say, okay, you know, in our area, we've been funding school services forever, but maybe there's a different way to do that and be more strategic. And we have gone to the state and locally and asked, you know, how do we utilize these dollars? Well, everyone's so afraid that our dollars are going to go away if they answer that question. But they haven't been giving us any answers. They're just like, you know, very vague about that. So having a better understanding will help us be more strategic. So thank you for that.
I think the name of the game here is braiding and blending funding, and having that message for the state, I think, is really important. I mean, I think you guys could be playing an incredible role as conveners. You know, if you're convening parties and talking about strategic alignment and braiding and blending funding, it won't be a feeling of they're going to take it away if there's another dollar. You know, convening your stakeholders and convening them with the state is one great way that you could be talking about, let's braid and blend our funding this way. These needs are not going to go away. That's the one thing we know, like especially children and youth. That's a tsunami coming our way. And on the other end, we have significant behavioral health needs with older adults that have never really been identified that are now also on the increase. So there's plenty of opportunity to braid and blend funding to lift all populations. And if there's a way that you can be a convener to help direct how the state even implements in your area, I think that would be a great additive role and a great role for the association and its members.
Yeah, it's a great point. I was just defending, you know, a lot of the, or a few of the 708 board debates have been close to Oak Park, which is my region. And I use the term force multiplier, that 708 boards are really the force multipliers in the community, because it's not just about the, the value doesn't rise just based on the amount of tax that we levy, but it's the expertise that we bring to table and the bird's eye view to be able to look at opportunities like that, where it's like, okay, you're duplicating efforts. Why don't you do this? We're going to then come in and fund this strategy that promotes what you're doing and increases access to it. So, you know, it really, and no one else is doing it with the eye to the eye of IDD, substance use, and mental health. So it has to be us.
You know, the other thing that I keep thinking about, and all of this started at the beginning of my career when I came to Illinois back in the 90s. One of the first organizations I worked with was the Township Officials of Illinois. Our state and our advocacy community, our state agencies and our advocacy communities never think about the 708, 377 boards, and they never think about the Township Officials of Illinois. Your association and the Township Officials of Illinois know much more about what's happening at the community level than even some advocacy groups and even some of our social service providers. You have a unique role in that you sit kind of between government and people, between government and the social sector. And it gives you this unique opportunity to not only be a convener, but to also help inform how the state directs dollars. And the CCBHCs are an opportunity, but I also think the investments from the Mental Health Block Grant present an opportunity for you, talking with Director Albert. But Chief Jones is also charged with coming up with a statewide, all 102 counties, behavioral health strategy that is comprehensive. And I really believe he presents another opportunity for you. You have data on what's happening in your community. And to get back with something that Christine said early on, oh, a lot of people are saying, oh, this federal money is coming in, and why do we need to be paying for some of these things? Well, I think putting it on the flip side, yes, this federal money is coming in. We are going to help inform how that money gets spent, again, strengthening the role of your board. Not only that, we are going to braid and blend funding. So when all of this interest goes away, we have something left. It's the one thing that our state is very, very bad at. And I'll say that after having lived here for so long. We are so bad at sustaining programs and services. And one thing that the Mental Health Board could be doing is even supporting some of the evaluation at the local level of what is working, what could be working better, and informing the state, because you know the state never evaluates programs. They don't have the wherewithal or the mindset. You could be providing some of that. You also, in my mind, are sort of speak truth to power because you have the local data, right? You can be talking about what are the needs of our constituency, how these dollars did or did not serve our community, because you should not be, along with the township officials, you should not be always putting your finger in the dike. I mean, it's great that you're now in a position that you might be able to braid and blend funding, but I think you're also in the position to be telling the state, how do we spend these dollars? Don't just duplicate or don't just throw good money after bad. How do we do this in a strategic way that is coordinated and is addressing not just the actual medical services, but also addressing some of the social determinants? And if there's, you know, I know not every board member and not every mental health board is going to be supportive of paying for social services, but that's where you can braid and blend with the state. If you can't get more dollars in it, if you're a true partner to the state and to these CCBHCs and these healthcare transformation collaboratives, you can be identifying where they can leverage their dollars in a way that you can't. And I just don't believe there's ever been that kind of emphasis or strategy before.
It'd be interesting. I know Jonah from NACBID is going to be at the December meeting. Be interesting to know if there are any 708 boards that specifically stand out as sort of the prime example of someone who's doing it really, really well or innovatively, if that's in an innovative way in their community. It'd be an interesting question to ask him.
You mean in Illinois or just across
No,
the-
nationally, like who is sort of the gold standard for doing this braiding and blending in a way that isn't just responsive and filling in gaps, but is more innovative and more just providing more leadership in the area.
Yeah, that's a good question. Any other thoughts from folks?
This is great. Just one sort of basic question. If you mentioned it already, I apologize. But I know this is being recorded, but will we have access to the slides or
Oh, I'm happy to send them out. I can send them to Jody and Jody can have them. So yeah. And I'm happy to answer any questions.
Thank you.
And, you know, Cheryl, you're in my community. I'm just right down the street. I'm on Wisconsin Avenue right now.
Yeah, no, and I mean, I remember you from my days back at the AIDS Foundation of Chicago. So yeah, it's great to see you again.
Yeah, that's awesome. I will send out the slide deck and a link to the presentation. And then if they have any questions, I'll just have them reach out to me and then I can, you know, list them out so you're not getting multiple emails, and then I can follow up on our end if that works for you, Barbara.
That's great. And I remember meeting Ron the last time I presented here, so I'm sorry he wasn't able to be here today, but you're in good hands. I'm sure he's advocating on your behalf with DMH.
Yep, he's doing a great job. And we have Lynn Canfield from Champaign coming up next, starting in January. So we have great leadership all around.
Great. Well, thank you for taking time out of your busy days to attend this. And I wish you much success. I think you're in a good position.
Thank you so much, Barbara. We appreciate
Thank
being
you.
here. Great presentation. Thanks everyone for joining us today.
Thanks. Take care.
Bye.